than any other museum in the world. But on Sunday, those hoping to see the Louvre were out of luck, as the museum's 300-odd staff voted almost unanimously to walk off the job. They were exercising their right under French labor law, citing risks to their health as the coronavirus continues to spread. France has already banned gatherings of more than 5,000 people, a fraction of the number who visit the Louvre on an average day.
There are visitors who come from China, for example, or other Asian countries where outbreaks of the epidemic have clearly been identified. We also have Italian visitors. So it's common sense to consider the Louvre a site where the epidemic could be propagated.
Tourists and Parisians alike were caught by surprise, as many were hoping to take advantage of the museum's free first Sundays.
Are we disappointed? Yes, because it's the first Sunday of the month and normally we can take advantage of Paris museums. But if it's closed, we can't.
So I'm from Italy, so my university has been closed for 2 weeks because of the virus, but I think it's not that dramatic, the situation. Like, people are going crazy for the virus, while actually it's not that big of a thing.
Of the roughly 10 million people who pack the halls of the Louvre every year, almost 3/4 come from abroad. Those hoping to visit this week, though, may have to wait till next time.
More than 10 regions are now affected by the spread of COVID-19 in France. The Oise department in the country's north is subject to stricter measures than others. Over 45 cases have been reported there. Schools in 9 of the department's communes are closed for the next 2 weeks, while markets have been forced to pack up.
We are facing, and I would like to explain this, an epidemiological mosaic, meaning very different situations at the department or even communal level. We therefore have a reactive attitude adapted to each situation, hence the differences in instructions.
A rise in cases has also been counted in the southeastern region of Haute-Savoie and the Île-de-France region, home to the French capital. One of the challenges is protecting healthcare staff from the virus. 3 medical personnel at the Tenon hospital in Paris are being quarantined.
Obviously, in an epidemic, we would be obliged to work differently. We won't be able to isolate all the caregivers who are in contact with infected people when they aren't symptomatic.
Already understaffed and faced with the seasonal flu outbreak, hospitals are fearing further strain on resources. In a bid to prevent further infections, the government has announced a countrywide ban on indoor gatherings of more than 5,000 people. Events such as the Paris Half Marathon, basketball games and the French Book Fair were cancelled, while the agricultural fair in Paris was cut short.